This week on Heal Yourself Radio, we have a two-part episode talking about concussions. It's the around the corner with the 2015 NCAA and NFL seasons, and there's no better time to bring more awareness to the topic of head injuries. This first part is featuring Dr. Tad Seifert, who is a neurologist who's doing some great work out of Louisville, Kentucky, and he's going to be sharing some of his expertise about post-concussion syndrome, return to play guidelines, and his thoughts on a highly controversial topic, which is chronic traumatic encephalopathy. The second part will feature Dr. John Letty, who will be sharing his thoughts on concussion research and the link between head injury and neck injury. So you don't want to miss either one of these episodes. So download them both and check them out. Today's episode is brought to you by uBiome. It is a company that is looking to study the effects of all the bacteria that exist on us today. This is not a diagnostic test. This is a test for research purposes and for you to investigate things and know how does your bacteria look like compared to an athlete. How does your bacteria look like compared to someone who does paleo? And you could use this tool as a way to see how your bacteria changes with different lifestyle changes. It's a really cool tool. You could check out my test on it at the uBiome blog. And you could also go to ubiome.com. And when you go to checkout, you could use the code CHUNG20. That's CHUNG, the number 2 and the number 0, and you'll save 20% off any kit that you buy at the store, which is a great deal. I only saved 10% on my purchase, so this is a way that you could save double what I did. So check that out. And as always, leave us some comments and feedback by giving us a rating on iTunes. But enjoy this two-part series about concussions. And here is Dr. Tad Seifert.
You're listening to the Heal Yourself Radio Podcast. Unleash the Doctor Within with your hosts, Dr. Jonathan Chung and Dr. Gregory Jean-Pierre.
Welcome to another episode of Heal Yourself Radio. As always, this is Dr. Jonathan Chung bringing you the best in health experts across the country so that you could be a more empowered patient. With the upcoming NFL and college football season, I felt like there is no better time to talk about a subject that's near and dear to me, and that is concussion treatment management. And hopefully one day we'll get to the point where we can prevent these things a little bit better. To talk about that, I have a neurologist with me. He is a prominent neurologist coming from Louisville, I believe. Doing a lot of great work with concussions and concussion research, and both on the research and clinical side. I have Dr. Tad Seifert. Welcome to the show.
Thanks, Jonathan. I really appreciate it.
So, Tad, why don't you go ahead and give the audience a little bit about your background?
Sure. I'm a neurologist that, like you said, based out of Louisville, Kentucky. And my practice it's a bit of a hybrid between a private practice and academic medicine. I'm the sports concussion program director at Norton Healthcare, which is more of a private practice-based group. But then I'm also on the clinical faculty at the University of Kentucky, so able to do some research and teaching through that institution as well. My interest in sports concussion really has evolved over time. I've always been an active person and was an athlete when I was younger. And in my neurology residency, I knew that somehow I wanted to try to marry the two interests of brains and neurology, which I love, and sports. I did a one-year fellowship at the completion of my residency in headache and facial pain in Houston, Texas. And there, my mentor in that program was Nyan Matthew, who was a headache specialist. And he took care of a lot of the local collegiate and professional athletes in the Houston area that were recovering from head injuries. And that's where I really came to realize that I truly could do both things and have a sports medicine themed neurology practice.
That's awesome, Tad. why don't we talk a little bit about concussion for people that are a little bit unfamiliar with what actually happens. A lot of people will see what happens on a football field. They know that, someone's bell gets rung, but they don't really know what's actually physically happening inside that person when a concussion happens.
Sure, and that's a good question. You know, a concussion truly is a traumatic brain injury. It's an injury of the brain. It's more than just a ding. It's more than just getting your bell rung. All the vernacular terms that we used to use when we were all younger and playing. I always try to explain to my patients that the injury of concussion is really a clinical syndrome of a multiple number of symptoms. It's not just headache. It's not just dizziness. It's not just light or sound sensitivity. It's really a constellation of things and presents differently in different people. The injury itself also, it's not a structural injury, meaning, standard CAT scans, standard MRI imaging techniques that we have available for use. If you scan someone with a concussion, you're not going to see a structural injury. It's more of an injury of function, or dysfunction rather. It's at the cellular level. It's the way that those cells and those neurons are communicating with each other, normally like you and I right now. But when someone has an acute, head trauma, the ability of those neurons to be able to function normally and communicate with each other normally are disrupted.
Okay. As far as treatment goes, obviously, when someone has a concussion type injury, say they're playing sports and they do take that hit and we do suspect a concussion, obviously you want to rule out things like brain bleeds and things of serious nature like that. And once those are ruled out, there are a lot of people that struggle with symptoms afterwards. Some people go on to have what's called post-concussion syndrome. At what point do some of these people need to really be evaluated by someone like you as a neurologist or other specialist when they're having persistent symptoms?
Now that's a good question. And, my general rule of thumb is that I usually recommend that people err on the side of being evaluated maybe a little too quickly rather than too late, just because you do have that certain subset. Some studies have estimated as high as 20% of patients with concussion will actually evolve into that chronic post-concussive process that you talked about. And once it gets to that point, it's very difficult to reverse and is very frustrating and can tend to be very refractory to treatment. I will generally recommend to individuals that if they feel like they are not improving within those first 24, certainly 48 hours after injury, that's the point in time when they should seek formal medical advice.
Okay, great. There's also a little bit of controversy brewing about what treatments are effective and whether to rest versus whether to start some movement or exercise. Can you address some of those things that are out there, especially some of the more controversial things?
Sure, yeah, and you're exactly right. And I think even just here over the last, 6 years, we've seen that evolve substantially, and there's been a bit of a paradigm shift there. If you look back at the Zurich consensus statement, the Zurich guidelines, they are essentially the gold standard on, return to play after concussion. If you look back at the 2008 Zurich guidelines, it had recommended complete physical and cognitive rest and complete physical rest until completely asymptomatic. And now looking, fast forward 4 years to 2012, the wording was tweaked a little bit to where it stated, cognitive rest, but symptom limited physical rest, meaning as soon as an individual started to feel better and could tolerate some light cardiovascular activity, that seemed to be best. And I believe that's where things continue to evolve. We realize that, or now we realize that individuals that are, especially athletes that are very active and used to being out, cardiovascular exertion every day, working out every day, being around their teammates every day, you injure them and then you tell them, go sit on the sideline or go sit at home, essentially until you're completely 100% symptom free, which in some folks can be 2 or 3 weeks, that's detrimental in and of itself as well. There certainly seems to be a sweet spot between too much activity too early, but also too little activity too early.
Definitely. One of the things that I really that drew me towards you and your Twitter profile, you talked about how head injuries and being able to play in sports are not two concepts that are mutually exclusive. You could have it both ways, where you could still enjoy, playing sports, and you don't have to freak out and worry about the constant threat of brain injury looming over you. Can you adjust that a little bit?
No, absolutely. And, you know, I live in the state of Kentucky, for example, and there is an epidemic in this state of children, under the age of 16 that are morbidly obese. Uh, and, there are multiple factors that go into that, but one of which is inactivity. So I think we have to be very mindful as healthcare providers. When we tell someone, a young individual, that you should get cardiovascular exercise, you should be active every day, you should do something that you enjoy, I think we should be mindful on not to necessarily limit those options. I always will counsel, young athletes as well as their parents that certainly there are some sports that are higher risk than others. But the problem with regard to concussion, that is, but the problem is not necessarily the injury itself, it's the mismanagement or the inability to recognize the injury when it happens.
Sure.
I certainly think that there's a risk-benefit profile there that we all should keep in mind when we're counseling these young athletes.
Definitely. And something that I've noticed from my point of view too is a lot of people will actually, even this goes beyond concussion, people will condemn certain sports and certain exercise methodologies and saying that it's dangerous. And on my head, I was like, you have a much greater risk of being sedentary and being hurt from being too inactive and suffering the diseases of inactivity than you do of attaining a serious injury playing recreational sports.
Absolutely.
So
100% on the same page.
I would much rather take my chance with possibly getting a sprained ankle or a hurt knee than worrying about getting diabetes 20 years down the line. And that's kind of what I try to educate my patients about. What are some things that you recommend for people as we're entering into the high school sports season? What are some things that you recommend for people to prepare for the season before they have to deal with some of these injuries retroactively?
Well, with regard to sports that are more contact risk, like football, like soccer, field hockey in this region is very popular. A number of things. Just having a good cardiovascular base, I believe, is very important. There are a small number of studies out there now that suggest that, certainly as we fatigue from a cardiovascular standpoint, we're at risk for really increased injury across the board, not just orthopedic injuries, but also head injuries. So I think having a good cardiovascular base and being ready when the season starts is key. Playing with good technique is very important with regard to football. Good head-up tackling technique, seeing what's coming at you and what you're getting ready to collide with. Having a good neck strengthening and conditioning program. There have been some good studies of late here over the last 2 to 3 years that suggest stronger necks decrease concussion risk. And just good hydration, I think, is a good general rule of thumb as well.
Awesome. Yeah, that's actually one of the things that I actually put a lot of my athletes through as a neck strengthening program. And I think even bigger than that, if we could get the female athletes to engage in that, I think that would really lower concussions across the board for a lot of just the youth population.
Neck strengthening is important, and it's also interesting because I'm involved a lot in combat sports here in the area with boxers and mixed martial artists. And when you look back, especially over the history of boxing, boxers have done neck conditioning for decades.
Yeah.
And they would always explain it. Well, I can take a punch better when I have a stronger neck. And that's absolutely true. And the same is, it correlates certainly with contact sports. When you get hit, you have less motion, less of that whiplash-like motion of the head and neck when you have a stronger neck. So mechanically, and just from a common sense standpoint, it makes sense as to why they're discovering that now through some good empirical studies.
Nice. What are some new treatments that you see coming along the horizon that you think have potential for helping a lot of these people that are suffering from the more chronic effects of concussion?
There's a real interesting compound that's in phase 3 of FDA study in migraine uh, called CGRP receptor antibodies. Um, and they're being studied and thus far have been shown to be quite effective in both acute and chronic migraine. And the reason why I say that potentially that's an interesting correlate to post-concussive syndrome, and I would say specifically to chronic post-traumatic headache that goes along with that post-concussive syndrome, is because there is a very, very similar pathophysiological mechanism between chronic migraine and chronic post-traumatic headache. And my suspicion is that over the next 2 to 3 years, we're gonna see that particular compound, currently in study for migraine and will likely almost certainly be introduced in chronic migraine, may well have some significant positive impact in those post-traumatic headache patients as well.
Awesome. I know another real controversial topic for a lot of people on there's people on both sides of the fence on this one is the topic of CTE.
CTE, I certainly believe that there is an association between contact sport exposure and cumulative head traumas and CTE. Now, there really is no level 1 evidence still available that is proving causation. Do I suspect that there's some degree of causation? Absolutely. But being in a field, medicine that is, based on science, I do believe that we need to continue to be very vigilant in striving to have that hard data in front of us before we make, generalizations.
Definitely.
But as a general rule of thumb as well, less head trauma for an individual is probably better. And just common sense tells us that. My hope for the field of CTE going forward here over the next 3 or 4 years is for them to also be able to study athletes that were involved in either, number one, no contact sport, i.e., track and field, something that generally did not have contact exposure, or something with much less contact exposure than, football or boxing or mixed martial arts. I believe this is going to certainly be clarified in the future, and probably the near future.
Good. Yeah, and I see a lot of the same things you are, because that's probably one of the biggest things that parents are afraid of right now is that they see, the Junior Seau story, and they're like, man, I don't want to put my kids through that potential situation. So you start to see football enrollment start to decline because
Right.
you know that people are generally, it's having an impact on the population as a whole.
And that's why I think it's so important for healthcare providers. We have to remember that when we say something, our patients are listening. So I think we have to be very responsible in that sense of not letting the media message necessarily outrun the data, not let the media message outrun the science. And at times I'm concerned that this particular topic has taken a turn down that road.
Definitely. In regards to some of the things that there is a little bit of data on, for example, like there is some research that says that, you know, college and high-level athletes show a little bit of cognitive decline, and a lot of NFL athletes suffer from musculoskeletal injuries later on if they've had a concussion. Do you believe that there are some things that they could do to kind of offset what's going on with that trend?
I do, and again, that's where I'd mentioned previously, and that's what I would stress again. I'm not convinced that the injury itself is the most worrisome part of the puzzle, although it certainly is a key part of the puzzle. But what I tend to be more concerned about is either number one, the misdiagnosis of the injury, so that it is therefore unrecognized for a period of time, or it is recognized but mismanaged, and people are put back into play prematurely or not taken out of play at all, to where those cumulative head traumas that occur in that acute to subacute time period after the initial injury can certainly predispose to much more morbidity going forward.
Gotcha. All right. Well, thanks for answering some of those concussion questions. Now, a couple of things. You seem like a healthy and fit guy, and a lot of our audience are definitely curious about some of the things that you do for your own health. Is there anything that Dr. Tad Seifert does for his own health that not enough people know about?
I'm a big weightlifter, and I have been really since probably mid undergrad. I'm 40 years old now, and I was, oh gosh, my sophomore year of college when I really started to pick up the weights regularly. I was about 20, so I've been at it about 20 years, and I find that I start to get a little nutty if I don't get into the gym 2 or 3 times a week.
That's awesome. That's actually something that I've gotten into recently as well. I've been doing a lot of Olympic weightlifting recently, and just found that it challenges me physically and mentally in ways that I never anticipated when I was just like a baseball player.
And you're a CrossFitter, right?
Yeah, I do. I do a lot of CrossFit. I'd still do it pretty regularly, but the past year or so, I focused a lot more on just the Olympic lifting aspect of it
Right,
too.
right.
So it's been a lot of fun for me. Um,
That's great.
So as a brain doctor, as a neurologist, are there certain things that you do to help make your brain work better or protect your brain?
Yeah, I really try to limit. Yeah, let me back that up. I really try to watch my diet fairly closely anymore. Now that I'm getting older and the metabolism has started to slow down, uh, trying to stay away from the processed foods and the fried foods. And my wife is pretty helpful in that regard as well. Uh,
That's critical.
Absolutely, absolutely. Yeah, try to get my sleep, try to get my hydration every day. Just the building blocks of good general health, which I think a lot of us, including myself, tend to overlook at times.
Nice. Do you prescribe to a um, not strictly to any sort of diet, but do you have like a model diet that you like to follow? And do you have any supplements that you believe are effective or useful?
I don't really have a set diet, and I never really have. I mean, I certainly know that there are diets out there with good evidence and that are good guideline, good guideposts for people to follow. But I just, as a general rule, just try to keep it healthy and try to have, a significant amount of protein every day of some source. Supplements, I do like the CLA, conjugated linoleic acid. I like branched chain amino acids. I take both of those daily, and then just a good multivitamin.
Nice. Are there any books or resources that you like to give out to people that make a positive health impact in someone's life?
Oh, that's a good question. That's a good question. With regard to, going back to concussion, the CDC has a really good, you know, general overview of concussion, both sport related and otherwise. But the CDC's website also has fantastic just general health information. You know, Essentially you can find anything on any disease state or just good proactive health measures, preventative health on their website as well. I refer a lot of people to that on a weekly basis.
Nice. And probably my last question is, Twitter has become this really awesome place where people could, almost feel like they're getting a face-to-face with various experts in different fields. Do you have any Twitter handles that you like to follow specifically?
I do. From the neurology world, I like I like to follow my friend Chris Giza at UCLA.
I like
Uh,
following him as well. He's a good, he
yeah,
puts out good
he's
stuff.
always a great resource with regard to neurological information. I've been really impressed with the new Surgeon General, Dr. Vivek Murthy. He's a good handle to follow. Um, and then just from an exercise and nutritional standpoint, I like the fighter's diet.
The
I
fighter's
don't,
diet.
yeah,
I gotta
yeah,
check that one out.
yeah. It's fantastic. She's very sharp.
Cool. So for everyone listening, in the show notes, go to healyourselfradio.com and I'll list all these things with the links in there as well. And for people that want to learn a little bit more about you and follow you, how can people follow you?
Yeah, my Twitter handle is at neurodoctad. That's neuro neuro doc doc tad.
Awesome. Well, thanks for your time, Tad. Really appreciate it. I think people could get a lot of information out of this episode, and hopefully we'll build some more awareness for this serious but manageable problem that people are having.
Absolutely. I'm happy to be on board. Thanks for asking me.
Thanks for listening to Heal Yourself Radio. If you like what you hear, show us some love on iTunes by writing a review or by sharing with your friends. We love interacting with our listeners. You can follow us on Facebook at facebook.com/healyourselfradio. You can find me on Twitter at Dr. Jonathan Chung. And you can always come to our website at healyourselfradio.com and interacting with us in the comments section. Hope you enjoyed the show. We'll see you next week.